So welcome everyone. Thank you to the participants and thanks everyone for coming and joining us tonight. My name is Paul. I'll go through a couple little things, but first of all, thanks to Denise. I really like the title, How Does My Lack of Quality Sleep Affect Me and Why Does It Make Me Feel This Way? So I'll go through some slides, and I think the best thing we were talking about, maybe if you have questions, write them down and we can go through them at the end, or I think they can pose questions too, if I'm not mistaken.
Yes, and they can put them in chat.
They can put them in chat. So
yeah,
do so. And at the end, we'll certainly have time for some questions as we go through them. Once again, this is being presented by the Canadian Mental Health Association with the help of Denise, of course, and myself. I work for a home care company, which is Maritime Sleep. I do the education for them. So I'll go to the next slide. Once again, thank you, Denise. I appreciate giving me this opportunity and just to spread the word of a little bit of what lack of quality sleep might be doing to all of us.
Perfect.
I'm one of those, so I'll go through a couple little things that affects me, and I'm sure many others. So just so people are aware, I don't, this educational role is really not a sales role. I go see doctors and all I do is talk to them about the patients that they should be looking at talking to about sleep. So if anybody's on the line and you're afraid to talk to your doctors, don't be afraid, because I do a lot of sessions with a lot of the GPs and the nurse practitioners and the specialists. And we talk about the patients that might have sleep apnea and are not diagnosed. The number that's a little scary is at the bottom there. There's only 18 to 22% of the people with sleep apnea that have been diagnosed. So that's where my job comes into play. So that really means, around 80% of the people out there have sleep apnea and have not been diagnosed. So if you're one of those and you guys are out there, you're not alone, of course. And I always tell people, it starts first with a question with your GP or with somebody that can help you, and then we work at it. I'll go through some slides and show you what we do after that. But this is something that's really underdiagnosed. The goal of my presentation, really, it's just to spread the word. You'll see I'll talk about how to better understand why you might be feeling this way, but also what are the symptoms. We joke about it, but a lot of women will say, I elbow my husband during the night to wake them up, to stop them from snoring. Well, that's a symptom. That's something that happens a lot. Maybe instead of elbowing them, you should nudge them in the direction of getting a test done, is how I put it. And, why do people go to the washroom 2-3 times a night? Sometimes they think it's just the way they are, but very often it is sleep apnea that's waking them up. And once they're up, they figure they might as well go to the washroom. Another thing that I want to spend a little bit of time with, but you'll see there's a ton of information out there, but the correlation between sleep apnea and mental health. There's a lot of correlation. It's not talked about a lot, but just to keep in mind that if you do have any mental health issues or you have mental health things that are happening, I always say make sure you're sleeping well, because that will only help you. And when I say well, it's the quality of sleep and it's not the quantity. So make sure you're having good rested sleep. And then I'll finish off with how easy is it to get tested, and is it really at no cost? And it is at no cost. And really my goal here is the patients that think they have symptoms, that think they should get tested, then I'm encouraging them to go see their doctor and go get tested. That's really the key. If you get tested and you're not one of those patients, then we stop it there. We don't put a CPAP on you and we We wait for the specialist to decide what to do, but we certainly would never start somebody on a CPAP if they didn't need it. And the goal here is really, if you do need a CPAP, the goal is to try to alleviate or diminish any other medical issues. And this may make patients feel better and ideally will help them live a healthier, happier life. So that's the goal. If you do need treatment, we just want you to be healthier and happier. People that don't sleep well tend to have trouble being happy and healthy all the time. The next slide, well, my goal is to try to get you from this in the morning to hopefully somewhere near this. So really that's the key. If somebody's having sleep issues, I always tell them, whether you do have mental health issues or you do not, it doesn't matter. You should find out what is the sleep issues and see if there's something out there that can help you. Once again, I put that same goal of success. It's really to make you feel healthier and happier. The success, somebody that has a CPAP and is successful, a lot of them will tell you they couldn't live without it, meaning they really want to wear the CPAP every night. So that's a successful. The next slide, I like to show what is obstructive sleep apnea. Quite simply, the normal airway, you see the arrows kind of have room to move air there. But when people sleep on their back, very often what happens is people with obstructive sleep apnea, when they sleep on their back, their tongue, their throat relaxes, and you'll see here is what pinches off the air down at the bottom. So you notice here, that's what causes patients to snore. That's what causes them to stop breathing. So this is really the goal of a CPAP, is to try to open that airway when you are sleeping on your back or on your side. The next picture is a little bit more graphic, but once again, same idea. It's where the tongue and the throat relaxes when you sleep. During the day, you don't notice this because you're standing up and you're awake, but at night, things tend to relax. And that's where people start snoring and they stop breathing. So those are two pictures. I always start with how common is sleep apnea. It is much more common than people want to believe. I know it doesn't seem like much, but 1 in 15 patients, if you think, you know, where you're at a hockey game and there's 3,000 people there, well, hard to believe, but 1 in 15 people at that hockey game probably have sleep apnea. And unfortunately, about 80% of them don't know it or they don't want to go get tested. So there's a lot of people out there that have sleep apnea. How many patients are diagnosed? Well, we talked about that. It's around 20% right now. So that's where my job comes in, and I try to go talk to the doctors and kind of explain to them, and the nurse practitioners and the specialists, I just explain to them who maybe are some patients they should be looking at or asking the question or getting a test done. I like this slide. This used to be the typical patient that we used to say, this is the only patient, you know, we should worry about that have sleep apnea. It used to be that guy on the right that was overweight and mostly men, and that was the picture of sleep apnea for years and years. But I would say in the last 5 to 10 years, you will notice in this next slide that there are a lot of other people that, and this is the slide that I show with my doctors, there are a lot of other people that should be tested for sleep apnea. So without going too graphic here, but this is simply the percentage of risk that these patients, so the obese patient, the guy that we just showed the picture before, he's got almost an 80% chance of having sleep apnea. But all these other categories, diabetes is a big one. 50% of people that have diabetes probably have sleep apnea or at very high risk. And if somebody has diabetes and is obese, the number goes way up. So that to say, there are a lot of other categories. So my job and what I do is explain to some doctors, and even I go to Weight Watchers and have talks with them, is to say, maybe we should test more people, not just the people that are obese, but the ones that are on hypertensive drugs, the ones that have atrial fib or other heart issues, and for sure, anybody that's diabetic that has symptoms. And that's one thing that my specialist will always say. We always want them to have symptoms, but you will see in the next slide that there's quite a few symptoms out there that I think we all of us have. But that's the key here, is to show that these are the key areas in patients. And if you'll notice here, for those that are looking at this slide, I had to write in 2 other divisions here, or 2 other, because when I talk with psychiatrists or psychologists, they always tell me, why aren't my groups there? And we actually had, in an office, we looked it up, and the numbers are very high there too. So there's very high indication that patients that are on antidepressants or antipsychotics should certainly get tested to make sure sleep is not affecting the medications that they're taking. So once again, a lot of groups, what symptoms should I look for and are the most common? And these are symptoms that people tend to blame on other things, but I really like this graph. It's divided nighttime and daytime. The big one that's often forgotten and often blamed on other things is early morning headaches. So a lot of patients who have sleep apnea, undiagnosed, will wake up with headaches for some reason. So that's something to look at if you're waking up often with headaches. Could be your body telling you that I'm not getting constant air in the morning, like all night long. All the other ones, the pictures here, are all things that we've seen before: the snoring, the pause in breathing, the choking at night, and people that seems to be wrestling with themselves all night. That's all signs and symptoms of somebody that has sleep apnea. The other ones we all know: poor concentration, irritable. The other one that I always mention is the frequent visits to bathroom. That's another one that's often blamed on other things, but keep that in mind, that if you have to get up 2 or 3 times during the night, and you've never been tested for sleep apnea, that could be the reason. Your body's semi-waking up, and because you're semi-woke up, you are actually having to go to the washroom. So the next slide is simply some other things that if people are having trouble losing weight, dry mouth, high blood pressure for no real apparent reason, quick onset of diabetes, those are all things that could be associated with sleep apnea undiagnosed. And I'll mention it here. I have no problem if somebody wants to contact Denise. If there's slides in here that they would like to have for themselves, they can either email Denise and I can send you these also, if you don't mind, if that works for everyone. If anybody's interested in getting a test done, it's extremely easy. There's a 1-page that I will show here. This is ours, but every company has these. There's a 1-page that you simply go through, you fill it out and fax it to the company. So basically, your GP or your nurse practitioner simply fills out 1 page, fax it to us, and we take care of the rest. Now, I know there's patients out there that may not have a family physician, may not have a nurse practitioner. I do have patients that go to walk-in clinics, and they can actually get a test started from a walk-in clinic with a GP or an NP. So keep that in mind. It doesn't cost you anything, so these tests are no charge. And there is a respirologist that actually reads the results and decides whether you need to go further with an actual trial. So all of this is free to you. The trial is free to you. So very important that you can get a trial done with a CPAP to see if you actually are able to use it. And I leave it down at the bottom for those that have private insurance. It usually covers 70 to 80% of the cost. So we would only charge you this to the insurance once you're happy with the device. And for those that are on social assistance, there is a medical card for those patients, for the people that are on social assistance, I should say. There's a card and there's a code that needs to be on there. It's an O2 code. So if you don't have that code, I know you can call a caseworker and get them to add that code on there. And that's the code that will cover 100% of the cost of the CPAP. So it's very easy. Once again, that's what the form looks like. Basically, they fill it out. They take off the trial, the study and the trial, and the doctor or the NP signs here, and they fax it to us, and we will follow up with you. So it's very fast. We normally can see people within 3 to 4 weeks. So it's quick. This is the one that we talk about. There's still people out there that know they have sleep apnea, but unfortunately they don't want to talk about it, or that they don't want to bring it up. But is it important to treat OSA? And I always say, for many reasons, it is very important. Not only to help you control your sleep, but it could actually make you feel better, feel happier, feel healthier. And if you do have other underlying diseases, maybe you have diabetes, or maybe you have hypertension, or maybe you're trying to lose weight, then treating OSA could help you with all of these things. So the slides that follow are the slides that talk about that. So somebody who doesn't want to get treated, you do have an increased risk of a cardiovascular event. So I will go to the slides. This is really a nice slide to show people it is important to treat. Quite simply, without getting too graphic here, everyone's got about a 7% chance of having a cardiovascular event. That's just the way that we are. After 12 years, not a big chance, but that red line is somebody who's got severe OSA and decides they did not want to get treated. So their percentage of chances of getting a cardiovascular event goes from 7% to 30%. So that's the reason why we tell people, go get tested. We'll see how severe you are. Maybe you're not, and if you're not, great. But if you are severe, we certainly will try to get you tested. So that's for cardiovascular. Diabetes, we already talked about it, but there is a direct correlation between somebody who's a diabetic and somebody who's untreated for sleep apnea. So quite simply here, these are just numbers, and this is the same patient, but the blue line was a patient that was not using their CPAP, and they're a severe sleep apnea patient. And so this was the same patient not wearing their CPAP, and when they were wearing their CPAP, their glucose values were much easier to control. It would drop it by almost 30%. So if there are any diabetics out there that are listening, or if you know somebody that is, and they're having trouble controlling their diabetes, they're having trouble waking up in the mornings, their numbers are really high, I would always get them tested to make sure it isn't sleep apnea that's causing those numbers to go high. And the reason this graph was really looked at and important is, I'll go to the next one, it just shows it in a bigger image. It just shows you that it was not only for breakfast, but for lunch and for dinner, these patients had numbers that were quite lower when they were wearing their CPAP. So quite simply, this 200 is worth about 10. If you look at the numbers, in Canada versus the States. But this is just to show you, if you wear your CPAP and you do have severe or moderate sleep apnea and you're a diabetic, you could reduce, and that could reduce the amount of insulin you would need. So for your diabetics, very important. The next one is hypertension. We talked about hypertension just quickly, but keep in mind that if you do have a new onset of hypertension, or you're having trouble controlling your hypertension. So this is a discussion that I have with my doctors a lot. Some patients, for some reason, they take meds for their hypertension, but they still have trouble controlling their hypertension. So keep in mind, these patients should be tested to see whether it is there's severe or moderate sleep apnea that's causing their hypertension to creep up. And even mild sleep apnea patients have a risk of hypertension. So there is a correlation between hypertension and sleep apnea. So once again, it's just to try to control that hypertension without adding new medications. So that's what sleep apnea and a CPAP do. I always put the pain there because a lot of patients do have chronic pain. And once again, there's a ton of studies out there, but it's just to let people know that if you're having trouble controlling pain, if you have chronic pain and it's been ongoing for a while and no meds seem to be helping or don't seem to be helping as much as they should, then it might be worth it to consider taking a sleep apnea test and to see whether the sleep apnea is causing some of these meds to not function as well as they should. And as we discuss a lot during conferences, there's some meds for your pain that could actually worsen your sleep apnea. So it's to be careful, to not take some of these meds or not take more of these meds than you have to, because it could worsen your sleep apnea. Because once again, when you relax all the muscles, your throat and your tongue, everything could collapse even more. So you could be increasing your sleep apnea. So anybody with issues controlling their pain, maybe get tested, ask your GP or NP to get a test done. The last one of the before last one, I've done a couple of talks on weight gain or difficulty losing weight. And again, I guess the key words here are, if you're one of those patients that you seem to be doing a lot of things well, but you still have trouble losing weight or you gain weight, you can Google, there's a ton of studies that show the correlation between untreated sleep apnea or OSA and weight gain. And basically, the studies have shown 70% of the people who are overweight are at high risk of having sleep apnea, so that we knew. But it's that when you are sleep deprived or you don't have quality sleep, the problems that happen that people are not aware of is that there's 3 hormones in your body that basically increase or decrease. And the problem with these hormones is that one, the leptin, which is a hormone that tells you to stop eating, when you don't sleep well, it's reduced in your body. So you have less of that leptin that tells you to not eat or to stop eating. But on the negative side of this, the ghrelin is that hormone that tells you to go eat, and unfortunately usually tells you to go eat some stuff that's not really good for you. And that ghrelin is increased when you do deprive your body of quality sleep. So these two are the ones that help you kind of from a mindset, are the ones that tell you to either eat well or don't eat well. And unfortunately, when you don't sleep well, they don't go in your favor. And insulin, we all know about insulin. When we don't sleep well, a lot of studies were done on patients that were not diabetics. And our cells resist or block insulin's effort to ferry glucose into our cells. So what it's telling the patients is that even if you're not a diabetic, when you don't sleep well and you wake up often and you don't have your deep sleeps, it's as if sleep deprived or lack quality sleep patients are becoming diabetic during the night. So very important, if you are trying to lose weight, if you feel like your metabolism is not fast, go get tested to make sure it isn't the sleep apnea that's causing this. So weight gain is another big one because a lot of patients, depending on the meds they take, depending on a lot of things, the weight gain is always a concern. Sleep divorce, I always throw that in there because we talk a lot about this, where a lot of couples don't sleep in the same room because the husband or the wife, I call it the elbow to rib syndrome, but it's basically rather than not sharing rooms and just telling your partner to go sleep in another room, I prefer the patient to go get tested and to see whether the snoring or the restlessness or other things are making it difficult for that patient. Get them tested to make sure that it isn't something serious like, or it is sleep apnea that's causing them to snore. So I always say sleep apnea may reduce the sexual quality of life. Doesn't help if they're sleeping in another bed, but also it's important to relate to that if you are lacking of quality of sleep, it makes everything else not work as well. So keep that in mind. So this is, I wanted to throw this in because we are talking about mental health. We are talking about patients that could have many of the listed items there. I didn't list them all, but the quick answer, and I hope everybody that's on listening to us, I imagine they have access to a computer. So it's very important that you can find additional information on all of these things. It could be mental health, could be depression, could be psychotic disorders, personality disorders, PTSD, et cetera, et cetera. You can simply type anxiety and OSA, which is obstructive sleep apnea, and you will get lots of information on that. So it talks about how it affects anxiety, how lack of sleep may be causing mood disorders to become worse, and personality disorders, same thing. So the studies will often highlight the importance of treating or controlling your untreated OSA to help you control some of the other mental illnesses that may be apparent. I know that there's quite a bit of information on all of these, but I know that there's a ton of information on like depression, PTSD, and just the lack of quality sleep that some of these patients might have. And it's kind of a catch-22. Some of these patients, because of the disease, have trouble getting quality sleep. But also if you add sleep apnea to that disease, then it could make it very difficult for them to sleep. So we always say, let's at least try to find out whether there's untreated OSA in these patients. These are just a couple other different ones, but I did go through, once again, some of the studies and some of the mental health meds and their side effects could increase your risk and severity of having sleep apnea. So once again, you want to try to control your sleep apnea, mostly if you have not been treated, because some of the meds that we take could be increasing your obstructive sleep apnea. Treating sleep apnea improves psychiatric symptoms. So there is a critical link and therapeutic target in mental illness, meaning everyone that does not sleep well finds it difficult in the morning. So it shouldn't be any difference from all the patients that I've named or all the different categories. Sleeping is extremely important. And studies have shown there's an association between sleep apnea and mental health conditions with mood, anxiety, PTSD, and all these diseases are affected by sleep apnea. There's a report, once again, these are just studies that I looked at or quickly Googled, but there are quite a few reports of higher risk of sleep apnea in psychosis and schizophrenia as well. So once again, patients that have these should get tested just to eliminate it and to make sure that it's not causing additional issues. Depression is the one that we talked about a little earlier, but sleep apnea can cause depression. Can sleep apnea increase your chances of reoccurrence? So it can not only cause depression, but it can actually increase your chances of reoccurrence of depression. So that's what they're saying. Even one night of restless sleep is enough to put a damper on your mood. But if you're constantly not logging enough shut-eye, you may find yourself feeling anxious and depressed. So once again, it's that long-term. We just don't want patients to go for years and years with lack of quality sleep. So we went through a couple different ones, but once again, if you Google any of the mental health illnesses and OSA and sleep apnea, you will find lots of information. this was an older study, but depression increased the risk of developing sleep disorders with breathing symptoms by 5 times. So once again, there is a link between both, but somebody who has reoccurrence of depression or has been depressed in the past, very important to keep their sleep, quality of sleep as perfect as possible. Another study showed that people with sleep apnea have a lot of depressive symptoms. So once again, there is a correlation. One thing that was important is sometimes the symptoms of depression will look a lot like the symptoms of sleep apnea. So they overlap. So sometimes it's difficult to figure out whether this patient has trouble sleeping, they have sleep apnea, or whether they're starting a relapse or starting to have a case of depression. So once again, get tested. At least we'll know if it is the sleep apnea that's causing it. PTSD, once again, there's a lot of studies on PTSD, but once again, it just says there is a correlation. People with PTSD, ideally, if they can sleep well with the CPAP, if they need one, it could help that. We talked about not logging up enough shut-eye. So if you're feeling anxious or depressed, make sure that we get as much quality sleep as possible. People with sleep apnea, this was an interesting one. People with sleep apnea 2 or 3 times more likely to get a bipolar disorder diagnosis. So what they're saying, once again, there's a lot of similarities between the symptoms and some of the patients, the way that they're feeling, and bipolar disorder. So important to get tested. Last slide on the mental illnesses, but once again, personality change, behavior changes, stress disorders, memory loss, all these things can be really affected with sleep apnea. So if you have any of these, or you know somebody that does, and you are thinking they do have symptoms, I would get them tested for sleep apnea just to make sure that they're at least sleeping as well as they can. There was some other hypochondriasis and psychopathic deviance. Once again, there is a correlation there because of the sleep disorders. These patients should get tested also if they have any symptoms. Correlation between personality traits. Once again, there's a lot of similarities of people that have sleep apnea, and if they're severe and they're not treated, then the lack of energy, the low self-esteem, the guilt, excessive daytime sleepiness often will fall into other categories. So keep that in mind. Some people might think that it's, might think that it's something else, but last but not least, eating disorders. Once again, same idea here. If somebody has sleeping disorders, it's important to make sure that they did get tested and for sleep apnea. So once again, I just kind of skimmed over the top, but it's important to know that mental health and sleep apnea, the illnesses, there's a lot of different types out there, but you can certainly find out online if some of these have a correlation with sleep apnea. I often put this question there. There may be a lot of the patients that are online that have tried a CPAP 10 years ago and it wasn't successful and they wonder what they should do today. And, you know, there's been huge advances in CPAPs and masks in the past 5 years. So every year there's always new masks and new devices. So I always say, get tested again, see where you're at. Ask them if there's new masks that you can trial, but be aware that there are much nicer masks on the market. I joke, this is not a mask, but some people still think that that's as comfortable as it gets, and it really isn't. There's some really nice smaller masks. These are 2 styles on the right. The ones on the left are the older styles, but there still are some new ones that come out almost every year. So keep that in mind. if a trial is not successful, we normally tell our RTs, the respiratory techs that work with us, to try 2 or 3 different masks. So if all else fails and you really can't handle the CPAP, there is good news. There is an option B out there. So in the past, we did not have an option B. If you failed on a CPAP, we kind of had to send you home and wished you luck. But today, there's something called a night balance. And what it does, it promotes you to sleep on your side. So I will show a picture. So once again, if your CPAP trial is not successful, in the past, we didn't have a lot of options, but today we do. It's called Night Balance. And what it is, it's quite simply a little belt. I wear one. It's literally this small. And this belt, basically you wear it at night. And what it does, when you turn on your back, it vibrates just a little, enough to wake you up to tell you go back to your side. So what this belt does, it really puts you in a position that reduces the amount of sleep apnea episodes. So this is, I call it an option B. We always recommend a CPAP first, mostly if you're severe, but for some patients, they are only positional. So once they're on their side, they don't snore, they don't stop breathing. So really a device like this, that's that small and they wear it on their chest, could work for them. But once again, this is something you need to get a test done, but at least there is an option out there. So if somebody fails on a CPAP, or if somebody doesn't have insurance and they don't want to pay the price of a CPAP, then there is an option B out there. It's literally that small. And it's been in Canada for about almost a year now, but it's been out in Europe for about 10 years. So it's not something new. It's called Night Balance. So once again, it's good news for those that have failed, but that they know they have sleep apnea. This could be an option to get you, I always say, to get you through the next couple of years until maybe a new machine comes out. The next slide, a lot of people don't have OSA, they get tested, but I still have trouble falling asleep. So you'll hear this a lot. They got tested, they don't have sleep apnea, but they still can't fall asleep. So the next slide is one that I tell the doctors and nurse practitioners to share with their patients. It goes over some sleep hygiene tips. So something about coffee intake, blue screens at night, stress and meds and everything else. But certainly I always tell people to discuss with your GP if some of your meds could be complicating your sleep patterns. Sleeping pills are something that I certainly recommend patients to talk to their doctors about, because sleeping pills were always intended to not be a long-term answer. Sleeping pills was supposed to be, I know in some cases, maybe a month, maybe 2 at the most. But unfortunately, a lot of patients have been using sleeping pills for years and years now, and they feel that that's what they need. But the problem with sleeping pills, it doesn't promote quality sleep. It gives you the quantity, you fall asleep and you wake up in the morning, but your body is not rested. So once again, for somebody who's got other comorbidities, sleeping pills may not be helping you get better, or may not be helping you go through that deep sleep and that recovery period of your sleep. So keep that in mind. There is no easy answer of getting off of sleeping pills. So I don't want to promote and profess that I know how it feels. There is no easy answer, but I would certainly talk to your doctors about that and get tested for sleep apnea. There are sleep specialists. I know I'm based in Moncton, but there's some respirologists, there's ENTs, and there's actually some sleep psychologists that patients can go see. I've gone to see sleep psychologists, and what they do is they really go through how you sleep and what you do, and they have some techniques that can help some people fall asleep and stay asleep better. So keep that in mind. Your doctors, GPs, or NPs should know some of these people, the specialists. I won't go through the whole list, but that's that sleep hygiene tip page that I leave with GPs and NPs and specialists. The big two that I think are often forgotten, or caffeine. For some people, they probably shouldn't drink caffeine 8 to 10 hours before they go to bed. I know it seems like a lot, but there are some people that the caffeine still affects them 8 hours later. And remember, caffeine is not just in coffee, but there's chocolates and other things that could be causing it. Couple things like try to go to bed at the same time. I know that's not easy to say. The other one is, of course, all these other things. Some of them are easy to do, others are not. The other thing is the phone at night. We always say, ideally, we all unfortunately use our phones at night, but it isn't the best thing to help you stay asleep. In closing, I guess this is kind of a summary of everything, but if you truly suspect you have obstructive sleep apnea and you have symptoms, get tested. It's free, it's easy, it's one night at home, you get tested, you bring a machine at home, you bring it back in the morning, and then a specialist will look at it and decide whether you should go get a trial done. Sleep apnea doesn't usually go away, so I tell people get tested to see where you're at today. And if you decide you don't want to do anything, well, when you get tested later, you'll know where you were and you'll know where you're at in a year or two from now, but it doesn't go away. So keep that in mind. And I already showed you the graph that after 12 years, if you do have severe sleep apnea, you don't want to increase your risk of cardiovascular events. So that's a big one. But if you do think you have it, get tested and then you'll see where you're at. Untreated sleep apnea can negatively impact you trying to control other diseases. So keep that in mind. Maybe it's your untreated sleep apnea that's causing your diabetes or your insulin you need more insulin, or your hypertension. It could be a lot of things that this is making worse. The tests and trials are free. The tests are easy to ask for, so it's a one page, so shouldn't be a problem there. And you can get them at walk-in clinics too. Maybe not all of them, but a lot of them. Remember, you're not alone with this, so talk to your GP, your NP, nurse practitioner. There are sleep specialists in your city or close to it, so you could always get referred to them. There are sleep psychologists that have an expertise in that. So I like to finish with basically a successful sleep apnea or obstructive sleep apnea treatment may alleviate or diminish other medical issues, may make patients feel better, and ideally will help them live a healthier, happier life. And really that's the goal. The patients that have successful therapy with a CPAP are the ones that see it makes a difference, and they seem to sleep better and they wake up more rejuvenated and happier in the morning. So that, in a nutshell, is my presentation. I wanted to thank everyone for staying on. You guys have listened to me till the end, so thanks again, and thanks Denise, and certainly we're open to questions. I do see that in chat.
Paul,
Yeah.
I have to say that anytime that I'm educating on mental illness, I always emphasize sleep is very important. I didn't realize how important until tonight. Like the correlation between OSA and mental illness is mind-boggling.
It is.
First of all, I didn't realize it was that big. I'm certainly going to share it with my coworkers, in fact. But I have CPAP, and I can remember prior to getting it that I would wake up in the morning and I was so sore, and I think it doesn't make sense. After sleeping for a night, I should get up and feel rested. But I get up and felt like I had run a marathon. my legs hurt, my back hurt, everything. So the first night that I put on the CPAP, the next morning I sat up in bed, on the side of the bed, I sat right up and I went, oh my God, for the first time in years, I had no pain. And I can remember when I went back to see the therapist or the lady that I was working with in regards to the CPAP at the clinic, I told her this and she said, Denise, you were never really reaching your REM sleep and getting that oxygen to repair your muscles,
Right.
what you put them through that day. And she said, that's what was happening. You weren't getting in enough oxygen through the night to repair the muscles. And that's why you were waking up sore. So having a good night's sleep was the most amazing thing. Like I was clear-minded. I wasn't emotional. I physically felt amazing because I wasn't full of pain. It made all the difference in the world, difference in the world when I got on my CPAP, and I was so thankful for it. So yeah, I really appreciate that you gave this talk tonight, and hopefully we've been able to help a few other people realize that, you know, there's no cost to it. It's not a big deal to go in and get tested. They set me up with the machine on Friday. I went in after work. They showed me how to get it all set up. I went home, I put it on that night. I slept with it through the weekend, brought it back in on Monday. They said, you'll hear back in a couple of weeks from us through your doctor. Within 3 days, they were calling me. I was a severe case, and they said, you need to come in now and get your machine. And boom, 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 everything was set up and very, very pleasant to work with. And it was one of the easiest things I've ever done, and I've never regretted it. So yeah, I really hope. I didn't realize there were that few people with OSA that were being treated. That number was very surprising.
Yeah, it's a surprising number because I don't think like anybody that we talk to that are in the medical field, they're all surprised by that number. Just, you know, but you're right. I mean, it's one of those things. It's an easy thing to get tested. Then at least if you don't have it and you have other issues to deal with, you eliminate sleep as being the culprit. And that's what we tried. You know, very often there's patients that have told me that they got a blood test done, they got an ECG done, they've got thyroid tests done, they've got all these tests done, and in the end they had sleep apnea that was causing their big problems. So we tell people maybe get tested early, and like I said, it can change your life. We change the lives of different people every day, and it
was amazing. Yeah.
So, and you know, the people that are listening, you know, it might not be them, but we all know somebody that snores, or we all know somebody that hasn't been treated. And
absolutely.
So, well, I don't think, is there anything else? I don't think so.
Yeah, does anybody else have any questions? Thank you for all the info. That was very nice. Thank you, Monique. Appreciate the comment. Yeah, and I did put my email address in the chat. So if anybody wants to send me an email, if you're looking for more information or contact, if you want to contact Paul, drop me a quick email and I can certainly help you out with whatever you're looking for. I do want to thank everybody for joining us tonight. It's the first of many Wellness Wednesdays that we hope to have over the next several months, and where we'll be talking about different topics in regards to our wellness. And yeah, if anybody has any ideas on topics you'd like to know more information about, send me an email and I'll see about getting a speaker in for that. So Paul, I thank you. You broke the waters, and you were our first speaker, and I do thank you for your time. And just so that everybody knows, there's no charge for tonight's presentation. This is a service that Paul provides in the community, and so it was very nice that he was able to join us tonight and do that. So I thank you, Paul.
Thank you, and thanks everybody out there, and we'll certainly be in touch. If anybody needs to get in touch with me, they know how to reach you.
Okay, sounds great. Thanks, everybody. Bye for now.
Thanks. Have a great night. Bye-bye.
See ya.